these dashboards are really exciting because data from the non-fatal suicide dashboard are considered near real time. And typically, our death and mortality data can be delayed by years. So this non-fatal suicide dashboard actually allows for rapid detection of suicide attempt emergent trends and like high risk areas, which can allow for more targeted interventions, maybe alerts to providers or deploying existing resources and programs for populations that are experiencing increased risk. The injury indicators dashboard provides historical annual data on suicide-related deaths, hospitalizations, as well as emergency department visits. While that data is not as immediate, these data are critical for more long-term planning, evaluation, and monitoring of suicide prevention efforts. Unfortunately, we do see leading cause of death, suicide being a leading cause of death for Michiganders and across the US. It's even higher among like young adults and other age populations. So sometimes you'll even see it as the second or third leading cause of death, particularly like the 15 to 24 year age groups. But suicide is really complex. It's a multifaceted public health issue. Suicide ideation and attempts often stem from a real combination of individual, societal, relationship, community factors. So those visiting the emergency department for ideations or attempts often differ demographically than those who might go on to die by suicide. Emergency department visits for suicidal ideations and attempts often include adolescents and young adults, particularly females. We're seeing more females in the emergency department than males. Youth and young adults, especially the females that I mentioned, they tend to use less lethal means, which means that the mechanism that they're attempting suicide with is less deadly. So they will often make it to the emergency department for treatment versus someone who maybe selects a firearm to attempt suicide, and that is going to be much more fatal. Departments are really capturing why a person is seeking care and includes like basic demographic information, but the data often lack context about life circumstances that could help with identifying risk or protective factors, as the emergency department staff are really focused on that immediate clinical need and crisis. Researchers have found that some risk factors for emergency department visits for suicidal ideation and attempts include like mental health conditions, like depression or anxiety, as well as access to lethal means or prescription drugs, and recent exposure to stressors like substance use or interpersonal conflict. So, and it's also important to note that a prior suicide attempt or prior suicide ideations are also risk factors for suicide, which is why this emergency department data is so important to help identify high-risk groups for early intervention. The decline in suicide rates is again complex and kind of multifactorial. The contributing factors are similar to what I mentioned before. They can be societal, community, or individual level, but some include economic factors like unemployment, financial strain, because economic insecurity can really impact your sense of self-worth. Sense of self-worth and future prospects, which really ultimately can lead to like feelings of despair. Social isolation and decreased social support removes an important protective factor against suicide. So those strong social ties that you have in the community or with, family members helps individuals navigate stressful events and personal crises. Increased access to lethal means like firearms is another factor. Research shows that states with higher rates of household gun ownership have significantly higher rates of suicide. And storing firearms securely and limiting access to those at heightened risk really can reduce suicide. Another factor can be untreated mental and physical health conditions, which can contribute to suicide because it really can debilitate the quality of life. Lack of access to affordable healthcare and quality healthcare, both mental and physical, can really exacerbate those issues. And lastly, really structural and societal issues like systemic racism and discrimination and trauma can contribute to higher suicide rates among certain groups like American Indian and the lesbian, gay, bisexual, trans, and questioning and queer populations.
Oh, not a problem.
Younger people are really they're choosing they're choosing less lethal means. So they're attempting suicide with poisoning or suffocation, and that allows them to get to the emergency department and receive life-saving care, where older men or older adults, particularly men, are really choosing those more deadly means of firearms. And that's why you aren't going to see that reflected in the emergency department dashboard. You can't even select firearms as a means of suicide in that dashboard because they often, those individuals don't usually make it to the emergency department for care. So there's not enough to report it. It falls under the other category in that dashboard. We really think it's important for people to learn the risk factors and warnings of suicide. So that's kind of our number one suggestion. If you haven't taken a general suicide prevention training like QPR, question, persuade, or refer, or safe talk, suicide alertness for everyone, those are really helpful to start if you haven't really learned anything about suicide prevention before. They're often usually only a few hours long, and the QPR specifically is offered virtually. Additionally, it's okay to ask someone directly about suicide. It's a myth that asking will put the idea in someone's head, and someone who's having thoughts of suicide actually usually feels relieved that they can talk to someone about it. So it's important to take time and listen to their concerns and reassure them that it's okay to feel that way. And then we're going to come back to the lethal means access, right? It's really important to make sure that your home is as safe as possible, especially if you have a loved one that's experiencing severe stress, anxiety, or depression. Firearms should be removed if possible during these periods of heightened risk. But talk with your child if they have thought about other ways that they might end their life. So make sure that you're thinking about medications or ligatures, things like that, sharp objects, and make a plan to remove their access to that as well. And then lastly, it's really important to get them help for any mental or substance use problems. And loved ones can always reach out to the 988 Suicide and Crisis Lifeline or a local crisis line if they're concerned about themselves or a loved one. You can call on someone else's behalf. We know that suicide affects all communities across Michigan. And compared to the Lower Peninsula, the Upper Peninsula and rural areas within the Lower Peninsula do tend to have higher suicide rates. Some factors that may contribute to that are limited access to mental health care, increased social isolation, maybe greater stigma around seeking help in rural regions. But in both peninsulas, white older men account for most of the suicides in Michigan, and particularly they are firearm suicide deaths. And again, particularly veterans, they are also having higher rates of suicide, especially firearm suicide. But research shows that male adults with firearms in the home are significantly more likely than females to keep their firearm loaded and unlocked, which can lead to that lethal attempt in a moment of crisis. Households located in the rural or suburban areas are significantly more likely than metropolitan areas to keep a firearm in the home, which increases the likelihood of fatal outcomes as well. Getting this topic talked about, awareness is so important. We also want to think about improving access to the internet and expanding access to telehealth care. That really can open up options for providers, can reduce wait times and things like that. We also want to reduce access to lethal means through secure storage, decrease stigma to encourage help seeking, train community helpers to really recognize that risk and connect people to care and resources. And when possible, use data to guide your efforts in this suicide prevention planning and programming.